This is a special request video from one of my followers. They wanted to know about destabilization between EMDR reprocessing sessions. Now we're going to talk about destabilization, and this is something that can occur with any type of trauma therapy that you're doing, but we're going to be a little bit more specific to EMDR because that's what they want to know about, and that's what I'm an expert in. So in case you didn't know, I'm Jessica Good. I'm an EMDR certified therapist. I'm an EMDRIA consultant in training. I also am the founder of The Good Practice, which is an online learning and social community for therapists, so that we can all learn and be better at our jobs and grow our businesses and all that, fun stuff that we want to do, right? So if you guys have questions about EMDR, make sure to pop them in the comments and follow along. I might make a video about your question. So first up, destabilization is whenever we are stable, right? For the most part, we can participate in work or school or our home life or whatever else like that, and we have some sense of stability. We're functional in a way, right? So what happens during destabilization is we're no longer functional in that same way. We might find that we can no longer participate in work or in our relationships. We are, experiencing a lot of flashbacks, activation, high emotional volatility, or a lot of dissociative episodes that are keeping us from fully being able to be present in our lives. So destabilization, going from kind of normal bumps in the road with life to, all over the place, that is going to feel really jarring for folks. Now, destabilization isn't something that should be occurring with normal frequency for somebody whenever they are doing EMDR therapy. And this is because in the 8-phase process, we have preparation before we get to reprocessing. And preparation is where we build up all of those resources. We're helping people feel really strong and secure in themselves so that whenever we do processing, that they're going to do really well both in session and outside of session if they're not able to fully complete a target in one session. Now, I'm an EMDR intensive therapist, so I do 3-hour sessions, which means that my clients are often fully completing 1 to 2 targets or memories or scenes or whatever we want to call it per session. But a lot of therapists are 50 to 60-minute sessions because they take insurance, and that's all that insurance will pay for. So it is not uncommon that you will have a session 60 minutes, you'll do like 20 minutes of processing during it, and then you'll do containment and then pick up that same target in your next session. So if you are doing that, there's a little bit more of a chance that that might come open between sessions because we try to put it in a container. We try to come back to it when you feel safe and ready to do so in session, but your brain's going to continue processing outside of session, even, with our best intentions to contain it. Now, for some folks, what that brings up, it might be emotions and feelings and all of that stuff that we do not feel equipped to deal with. And if that is happening, right, if destabilization